What hospice gives to the community is a type of care that is very, very hard to achieve for patients at the end of life. And what hospice gives is a team of experts who do this all the time and who care, I can't tell you how passionately, about what they do.
Hospice exists really to provide comfort and care for people at the end of their lives.
My definition of hospice is it's the most compassionate pursuit that a person could ever choose to do with their life. What else out there exists purely for bringing comfort to people who are in an uncomfortable, scary situation? When my mom was told that she had stage 4 cancer, she knew that she was going to die. And she wanted to die with comfort and with her family around her and with dignity. She didn't even have to communicate that to hospice.
Patients in general are worried about the indignity of the dying process. And one of the goals of hospice is to take that fear away.
Each of the members, the nurses, the chaplains, the home health care aides, the bath aides, care to a person, care so much about every patient they take care of, even the difficult ones.
The job satisfaction is unlike anything I've ever had before. It is the satisfaction of coming into a very difficult situation and bringing help. So many times people have told me, I don't understand how this works, but I feel so much hope now. These are people with terminal illnesses.
They just have an amazing amount of knowledge. Some of these nurses have been in the field for over 20 years and in critical care. And you can call anyone at any time and ask a question. You know, if you're in the office, if you're out in the field, you can always call and get backup, so that's really nice. You don't feel like you're doing something alone.
The nurses are so clear at explaining to the patients what's going to happen. They are gifted in that respect. They talk in non-medical terms. They answer every question. There's nothing that they don't answer. It's a very honoring thing for the patient to be talked to like that.
Hospice will take care of patients regardless of their ability to pay. And that's why the Whatcom Hospice Foundation exists.
Foundation pays everything that we don't get in any other way. We don't bill families, so everybody from age 5 to 102 at any given time. Any disease, there's lots of diseases out there, cancer and heart and ALS and just there's, you know, everything. This is all about you. We work for you. We do it your way. We ask you, what do you want to do? How do you want to do it? We don't have to agree with you, but we will honor your decisions.
The beautiful part of this is people get the level of care that they want and need.
So you could see the hospice nurse twice a week, or you could see her twice a day. It really depends entirely upon how you're doing.
Giving independence and dignity is probably one of the most important things we do. And they have the right to direct this time of their life. This is your time. You know, this is your life, and you make these choices for yourself.
There are a lot of advantages to having hospice, even if you're in the hospital or in a nursing home. Nursing home staffs are, you know, they're very busy, and so hospice will come in and give extra care.
As far as medical oversight is concerned, 24 hours a day, 7 days a week, it just doesn't get any better than that.
To truly understand what that means, to die well, to be at peace with family, friends, with however you see creation and on what the next big adventure is in life, is an enormous thing to give somebody.
Death is happening to everyone, and it's not something that you generally can do by yourself, and you shouldn't have to. To have people come into your home that really care is a wonderful thing. And to help manage all of the care needs, to sort of take that pressure off of the families is priceless.
Hospice is so much more about just the patient. It's about the family unit and making sure that they're all as comfortable as they can be in this time of crisis.
When you've done something for the hospice agency, you've accomplished something. There really is a sense that I've made a difference.
There are many worthy places to make donations. I think the reason that I would ask folks to donate to hospice is that we will spend your money wisely to make people's last days as meaningful and valuable as possible.
At the end of life, it's kind of like your whole life comes into focus. The meaning of your life, the meaning of other lives that are close to you, and what's beyond all come together.
We're all going to have to stare into the unknown and wonder what's out there, and you know, wonder what's in the next life or whatever, and how much more comfortable will that be if you have professional, compassionate caregivers surrounding you. One of the most extreme experiences of my life, one that is burned into my memory forever, every little detail of it, is when I was with my mom when she died. The only thing comparable to me that I've experienced is when I'm doing what I love to the core of my soul. It's the same feeling I get with the comfort and that flash at the end of life when a person when they're dying and they know that there's someone right there with them holding their hand. Their only thought is, I'm here for you, and I'm here to bring you comfort. It's okay. You're okay. You're not alone.